Hi, I'm Mandy Highland at Highland Meadows. I am the clinical director here at Highland Meadows, as well as one of the DBT therapists here on our DBT team. And I am going to take some time here to just explain our DBT program for people that may be interested in that or have been told that they might benefit from this treatment, and just to give you an idea of what it is, what you would be committing to if you did our program, and just explaining the different components that that treatment model offers. Many people have a little bit of a misunderstanding about what DBT is, thinking that it is a skills group when that is a component of the model, but there's much more to it than that. So you can always call the office and get more information about this, but here's just a brief video giving you an idea about what that is. So DBT is dialectical behavior therapy. It is a treatment model it's an emotion-focused treatment. It's really designed to help people who struggle with emotion dysregulation. There's been a lot of research. The research initially was with a certain population of people who had borderline personality disorder. However, it has since expanded and broadened, and there's been a lot more research done on other not only just diagnoses but just other difficulties that people struggle with that DBT is also an effective treatment for. What I guess dialectical behavior therapy is a form of cognitive behavior therapy. Many people are more familiar with that. And the research found that regular cognitive behavior therapy wasn't showing to be as effective for people with emotion dysregulation. And part of that is because cognitive behavior therapy is very change focused. It is focused on changing your thoughts in order to change how you feel, in order to change how you behave, which can be great and really effective for many people. However, the research was showing that those with high emotion dysregulation weren't getting better with regular cognitive behavior therapy. And so Marshall Linehan, who is the developer and the researcher behind dialectical behavior therapy, decided to take cognitive behavior therapy and then add in some acceptance-based strategies as well. And that's where dialectical behavior therapy came from. So it's a combination of change strategies as well as acceptance strategies, which is what a dialectic is. A dialectic is two kind of opposing things that both exist at the same time. So hence dialectical behavior therapy. So our program here at Highland Meadows is we have both a state certified program as well as nationally certified program, which really just means that we have demonstrated that our program, the way that we do the treatment, has fidelity to the model, that we follow what the research says to be the most effective form of treatment and incorporating all the components of the treatment. That the requirements to do our program for adults is a 1-year commitment. This video I'm going to actually focus on our adult program, and then there'll be a separate video talking about our adolescent program because there are a few differences between the two. So it's a year commitment, which can seem like a really long time. And I think sometimes when you think about, in the big scheme of things, if you've been suffering for years, a year of doing treatment, if it's going to help you get better and not stay in therapy the rest of your life, maybe it doesn't seem so big then. However, it does seem like a long time for people up front. And I always want people to know that if you're going to do our program, we are asking for that 1-year commitment in order to start in our program. So there's different components to the model. I'll start with the piece that people tend to be more familiar with, which is the skills group component. Skills group is where we are teaching 4 different skill sets to help you learn how to better manage your symptoms, really. So one of the modules that we teach is mindfulness skills, core mindfulness skills. That's really where we are teaching you how to have better awareness, teaching you how to have awareness of emotions, thoughts, things around in your environment, things going on around you, so that you can have better control. Because if you can have better awareness of what's happening in your body when you're having an emotion, you will have better control over that. The next skill set we teach is called distress tolerance. Distress tolerance skills are, we call them crisis survival skills. They're really skills to help you when you are in a crisis situation, or when you have a really high emotion or really high urges to act on a behavior that's not real effective. How do you survive that, or how do you tolerate that without acting in a way that's going to make things worse? So that's where we're teaching just distraction skills. How do you kind of distract from the thought that's distressing? How do we help you bring that emotion intensity down by maybe changing your body chemistry? We teach self-soothe skills to help you learn how to do that for yourself, since we can't depend on other people to soothe us all the time. The next module we teach is emotion regulation skills, which is all about learning to regulate better so that your emotions and urges don't get so high so often, so that you don't need to use distress tolerance skills as often. That is skills around kind of being able to identify your interpretation of an event or a situation and how that impacts what emotion you might have, learning ways to change your interpretation in order to change your emotion, being able to check the facts. Does my emotion actually fit the facts of the situation? Also learning ways to act opposite to your emotion urge. We also teach how do you accumulate more pleasant emotions more often. Also talking a lot about what's your values, what are your value systems, and are you doing things now within your life that fit within that? And if not, how can you start to do more of that? We also teach, the next module then is interpersonal effectiveness skills, which is all about relationships and communication. How do you communicate in a more effective way to get your needs met? How do you ask for things in a way that people are more likely to give you what you're needing more often? How do you have healthier relationships? Maybe you need to end relationships that are toxic. How do you do that? And how do you keep your self-respect at the same time as getting and keeping relationships? So that's what skills group is about, learning all those different things. It's not a process group. Some people have done therapy groups in the past that have been more process types of groups where you're talking about your own personal things going on in your life. In DBT, we don't do that. It's really more of a class where you're learning skills. The reason behind that is that often in process groups, if people are talking about their personal situations and things, well, in DBT, people coming into DBT usually have an emotion regulation, have emotion regulation difficulties already. And when people are processing and talking about kind of their own problem behaviors, it can be triggering to other people. It can cause other people's emotion intensity to rise. And research shows us that when our emotion is high, our ability to process information goes down. And the goal in group is to just learn information. We want you to learn the skills. And so we want to keep emotion low. And that's why there isn't processing about problem behaviors in group. That's done in individual therapy. And so that's a little bit different maybe than other types of therapy groups that people have done. Excuse me. Skills group is once a week for 2 hours. At this time, we have 4 different adult times for people to choose from. And if you decide to do our program, once you would start here, you could decide which group time fit best for you. So once a week for 2 hours is group. And there's about 8 people in a group on average. That can fluctuate a little bit. And then there's 2 therapists that facilitate group. The next component of the DBT model is individual therapy. That is once a week. On average, it's normally just once a week for an hour session. Individual therapy in DBT can look a little bit different than other treatment models. It's maybe a little bit more structured than what somebody might be used to. Those first few sessions in individual therapy with your therapist would be identifying what we call a life worth living goal. And that is you figuring out what do you really want your life to look like? What would your life look like if you didn't have any of the difficulties or struggles that you're having? And then you and your therapist are making a list of things that are getting in the way of that happening. So kind of problem behaviors. What are the things that are getting in the way of you having the life you want to have, and how do we help you change that? And what are some things that you want to increase in your life as well? And then we create kind of your treatment plan, or we develop this list based on this hierarchy, we call it in DBT. At the top of the hierarchy is if there's any suicidal behaviors or high suicide ideation. Because if we can't keep you alive, we can't get you to your goal, and so we need to keep you alive. Also in that category is, in that top category is self-harming behaviors. So if someone has self-harming behaviors or suicide thinking, that's top priority. Next step down on the hierarchy is what we call therapy interfering behaviors, and that's anything that the client or the therapist is doing that is interfering in keeping you in therapy or helping you get to your goal. And so we are always wanting to talk about those things if they come up. So if the therapist is, an example, maybe if the therapist is late to session week after week, that's wasting the client's time. That's wasting your time. And so the therapist would want to be working on that because that's interfering. That might make you not want to come to therapy. So we would just be identifying anything that's happening that's getting in the way of the therapy relationship, of helping you get to your goal. The next step on the hierarchy is what we call quality of life interfering behaviors, and that's, again, anything interfering with the quality of the life that you want to have. Some examples of that might be substance use. It could be just things, the way that you interact within relationships and communicate. Could be maybe someone that's depressed and they sleep and can't get out of bed, and then they can't get to work, and that's just getting in the way of their life. And then we're going to prioritize those things and have you be tracking them during the week on what we call a diary card. You're tracking suicide thinking and urges, specific urges to act on other behaviors you're trying to change. And then in session, that's what guides the session. So if there are certain behaviors happening that you're working on changing, we're doing what we call behavior chains to figure out what is contributing to this happening more often or on certain days versus other days. What are some of the different emotions and thinking and things going on in the environment when that happens? What are the consequences of that? And then helping you figure out how do we change this so that it doesn't continue to happen. And so that is happening before we talk about other things in therapy. So the goal is to kind of avoid spinning in crisis of the week stuff. So sometimes in other types of therapy, a client would come in, maybe say, I had this big thing happen during the week, this big kind of crisis situation, and then the session is focused on talking about that and kind of putting out fires from week to week. And we never resolve the underlying issue. And so the structure helps us avoid spinning in crisis of the week stuff, where we can, people who tend to have emotion dysregulation disorders to do better with this structure it shows within the DBT model, where we can avoid spinning in crisis of the week and have this structure that we're following. So that's the reason behind that. So that is really what we would call stage 1 therapy in DBT. Stage 2 therapy is if someone has a trauma history, if someone's coming in and they have PTSD or a trauma history that they are wanting to work on. Oftentimes the trauma is what's sort of driving the other stuff and the other problem behaviors, and getting to the point of doing the trauma work is really where we want to get to resolve some of that underlying stuff. And so stage 2 DBT is where we're doing trauma work. And in our program, most of our therapists on our DBT team are trained in prolonged exposure trauma model within the DBT model. And there are a couple others that are trained in some other in a different trauma model, trauma-focused DBT. However, at this point, most of the research is saying within the DBT model that prolonged exposure is the research-backed trauma model to be utilizing, which is what we're doing. So that is when there is an active self-harm happening for a minimum of 8 to 12 weeks. Then a person could do trauma work. We just need to make sure that people are ready to do that before we start that work. And that is, again, another very structured model, sort of a model within a model. It's 8 to, I would say 12 to 16 weeks within the DBT model itself. So that's individual therapy. Another component of the DBT model is phone coaching. Phone coaching is where each client has their therapist's phone number, contact phone number, cell phone number, to be able to get a hold of them outside of normal business hours. And so if it's 8 or 9 at night and you are having really high emotion or really high urges to act on a behavior that you're trying to stop, you can call your therapist for phone coaching to be able to get some skills to use to bring your emotion down, bring the urge down. It's not therapy over the phone. It's not processing the situation. It's just getting some skills. And so the reason behind that is to help you to generalize the skills that you're learning in group and in therapy into real life situations. It's easy to sometimes come to group and talk about it in group and learn the skill and think like, yep, I got it. And then you get in a real life situation and it's much more difficult to remember in that moment what to do. And so phone coaching can help with that. There are some rules around phone coaching that it has to be used before you act on the behavior that you're trying to avoid doing, that you're trying to change. And so if you call after the fact, if you call after you've engaged in the behavior, you actually lose phone coaching privileges then for 24 hours because we want to reinforce skillful behavior. And so you and your therapist would definitely be talking about what that would look like, what their limits are with phone coaching, what you would do in the meantime if they didn't answer and you needed to wait for a call back, and how to use that in a way that works with you and the individual therapist that you would have. There's also this idea within the DBT model that's called consultation to patient, where we aren't consulting about clients with other providers or other people without the client's knowledge or without you present usually. And so the reason behind that is we really want people to manage their own lives. We want you to learn how to manage your system. If there are people wondering how you're doing, or if people are wanting to know how, wanting to give your therapist information about you, we would really just be responding by saying, we want them to manage their own system. I'll let them know you want this information, and we would be talking with our client about how to go about doing that. If you need some guidance, we're happy to do that with you, but the goal is to help people be healthy, normal functioning people who don't stay in the mental health system forever. That we want you to be able to manage your life and not be in therapy forever. So that is really kind of the overview of the treatment. There's a little, there's obviously it goes into a little bit more depth once you start. However, that's sort of the big picture overview. So if you have further questions, if you're interested and you want to set up an appointment to come in and have an assessment to see if it's a good fit for you, certainly call the office. Our office number is 507-288-6978, and we can get you set up. All right, thank you.